Hi, I'm Emma, and welcome to this overview of the Clinical Patient Management System. The version I am going to be demonstrating is version 16. This version was released on the 19th of September 2018. To get started, log in with your EU login. If you need help setting up an EU login and requesting access to CPMS, please contact the help desk, who can provide detailed videos demonstrating each step. If you are logging in for the first time, you will be asked to write your professional role and to select your thematic areas. The latter is important, as it will determine whether or not you will be able to be invited to panels later on. Once you have saved your preferences, you will enter into the system. The first screen shows the applications you have access to. On the left, a list of training videos. In the middle. On the right, you will see parts of the available documentation. More documentation can be accessed via the menu at the top. Here you will find an FAQ, containing the most frequently asked questions. Also, user guides and security documentation. I strongly recommend you familiarize yourself with what documentation is available, as most common questions will have their answer in this section. The first application I will be demonstrating is the map. It shows the location for each of the participating healthcare providers on a map. You can view all of them at the same time, or only those who are members of a specific ERN. The application is capable of zooming in all the way down to street level. It also shows the official website for each ERN in the top right. The next two applications are the Center and the ERN application. The Center, this is where you will be able to enroll new patients, and also see a list of already enrolled patients. The ERN application, this is where you will see a list of your panels, both those you are leading, and those you are contributing to, and also invitations for new panels. You will also see your meeting invitations and tasks. Going back to the Center again. I will now demonstrate enrolling a patient. Please note that all authorized users from your Center can see all patients enrolled within this Center, regardless of which ERN they are participating in. You must first select the date of enrollment. There are 3 consent boxes to fill in. Consent for care is the minimum requirement for opening a panel for a patient. The other 2 are consent for ERN databases/registries, and also consent for research. To find out what each type of consent covers, you can view the model consent form, which can be downloaded directly from this screen. It is available in all EU languages. Finally, you must enter the first name, last name, gender, and date of birth. The record label is generated automatically, but can be edited if needed. The other big thing you can do in the Center application is to see a list of all patients enrolled within your Center, regardless of which health professional did the enrollment. From this list, you can change enrollment data for all patients, and also, you can wipe the entire patient record, if required. The final thing, and probably the most important thing you can do in the Center application, is to start a panel. You do this by finding the patient you want to open the panel for on the Center's patient list, and selecting the option, Open New Panel. The minimum requirement to open a panel is that you fill in the mandatory fields on the consultation request form. This includes giving the patient a nickname, one containing no parts of their real name. Although not mandatory, you can also specify whether or not the panel is urgent. Selecting this option will place the panel under the Urgent Panel widget on the ERN dashboard for all participants of the panel. Also, when at the panel selection stage, which we will see later in this video, those experts you invite to the panel will be notified immediately, as opposed to non-urgent panels, where they are notified only as part of the Daily Digest email, which is sent out once per day, at 9 AM CET. you need to specify whether the panel is a repeat of an existing panel, as well as writing a short consultation request description and a consultation request reason. You also need to select whether the reason for the panel is to arrive at a diagnosis, treatment, or something else. You need to enter the name of the healthcare provider under which the patient is being treated. Similarly, the name of the point-of-care specialist, who is the actual physician treating the patient. It is not mandatory that these are ERN members. Finally, you need to select the ERN this panel is created for. CPMS will display the ERNs that the enrolling healthcare provider is a member of. You will also be asked to select the panel lead, which, at this stage, has to be from the enrolling healthcare provider. The lead can be changed later, in the panel selection stage, if required. Lastly, you need to pick which of the selected ERN's thematic areas this panel is related to. When all this is filled in, you can open your panel by clicking Create Panel. Now your panel is open. Before going through the patient journey, I would like to first show the workflow itself. Each step of the panel is represented by a circle. You are able to freely move forwards and backwards between the panel selection stage and the outcome stage. Once you move to sign off, you can no longer go back in the workflow. However, you will still be able to restart the panel, which I will show later in this video. The first stage of the panel is called Open. Here, you will have your first chance to edit the various data forms. The forms can easily be navigated using the menu on the left. There are too many data forms to go over in detail in this overview. An example is the rare disease diagnosis form, which allows you to enter information using several different diagnosis coding systems, ICD-10, ICCC3, or Orphanet. Other forms can use other coding systems, like for example LOINC. CPMS will automatically search its coding database when you start typing in the search box. Alternatively, all fields, which is a magnifying glass next to it, can be searched manually. In any form, only red items are mandatory. Another highlight is the family history form. It contains a full-featured pedigree tool, which allows you to map out a patient's pedigree in great detail. The pedigree tool supports the phenotypic abnormality coding system, HPO. You can export your pedigree chart as a JSON file, or in the image format PNG. Finally, you can also upload an existing pedigree image. To get familiar with the numerous data forms, I strongly recommend that you try out the CPMS training environment. Here you can play around with the system and try out all its features without using any real clinical data. Just contact our help desk, and they will provide you with all the necessary information to log into the training environment. One final thing before we move on. The data forms I have briefly shown you are based on the common data elements which have been implemented for each ERN. However, these are not set in stone. They can be modified to better match your ERN's specific requirements. To find out more about how to get the data forms for your ERN modified, please contact our help desk. So, moving on. The panel can now be moved to the next stage of the workflow. However, although I'm the panel lead, and no one else has been invited to this panel, I'm not the only one who can move this panel forward.
Hi, I am Dr. Harry. I work in the same healthcare provider as Emma. Although I was not invited to this panel, and I did not create it, nor did I enroll the patient, I can still open the panel and move it forward to the next stage of the workflow. This allows Emma and I, and other healthcare professionals from our institution, to work as a multidisciplinary team. Also, it means that Emma's panel will not be blocked in case she is absent for an extended period of time, or in the event that she leaves our hospital.
The panel selection stage. This is where you can invite other experts to consult on your panel. You can invite experts purely based on the thematic areas you selected when you open the panel, or you can invite experts from the entire ERN. As the current panel lead, this is where you can change the lead to someone else, if required. You are also able to accept invitations on invitees' behalf. You might also want to invite experts from another ERN, or even someone who is not a member of any ERN. This is possible, but can only be done by users with the coordinator profile. You can request the coordinator assistance with assembling the panel by clicking on their "I would like assistance" button. Doing this will place a request on the coordinator's dashboard.
Hello again. Apart from being a doctor in the same hospital as Emma, I am also the coordinator of the ERN. The request that Emma made for assistance will appear on my dashboard. When I click it, I will be redirected to the panel, where I can go to invite members. Unlike Emma, I will have the option to invite guest members. This can be a guest from my own ERN, or from any of the other 24 networks. I can also forward the entire panel to another ERN, in the event that the condition described in the consultation form is unsuitable for my own network.
Once all invitations have been accepted or rejected, you can move your panel to the data completion stage. Please note, any request still left on pending when you transition to data completion will automatically be set to rejected. In the data completion stage, you will be able to revisit the data forms you filled in earlier in the open stage. Again, I strongly encourage you to get familiar with all the data forms in the training environment, as there are too many for me to go over in any video. However, one that I will be looking at in this video is the medical documents form. In this form, you can upload various kinds of attachments to your consultation form. You can add files individually, or you can use FTP. You can also use Integrated Healthcare Enterprise, IHE, if your center uses it. Once added, the files will appear on the consultation form. DICOM studies appear in a separate section. We will see why in a moment. The rest of the files, depending on their format, can be previewed directly in CPMS, or can be downloaded locally to your computer. The DICOM studies appear separately, because these are opened with the integrated medical viewer. The medical viewer allows you to view individual DICOM studies, or you can view up to 4 studies at the same time, simply by dragging them across from the study selection on the left. At the top, there are several tools at your disposal. You can move the image around and zoom in and out. You can also decrease and increase the brightness. The viewer has brightness presets already available, depending on what you are looking at. You also have access to a magnifying glass, which lets you increase the magnification level up to 10 times. The image can be rotated left or right in 90-degree turns. Similarly, the image can be flipped horizontally and vertically. The viewer also has a series of measurements and annotation tools. These allow you to measure and highlight part of the image. You can measure in rectangles, circles, angled or straight lines. The annotation tool itself takes the form of an arrow. You can point to a specific part of the image, and a text box will appear, allowing you to write the specific annotation for the point you highlighted. The measurements and annotations you, or other members of your panel, make on the images, can be viewed by every member of the panel. Finally, the medical viewer can also play back DICOM videos. On these types of files, you do not have access to any of the tools, so you cannot annotate or perform measurements. You can, however, write a comment in the comment box on the right, which other members of the panel will be able to see. After reviewing all the data, uploaded into your panel, it is possible that panel members would need additional information in order to make a proper assessment in the next stage of the workflow.
I am a member of this panel, and I would like some more information added to the patient file. So I will open the panel, and select Request Additional Data. When I click that button, a box will appear, where I can write my question. When finished, I click Create Request. This will put a request for additional data on the ERN dashboard of the panel lead.
The additional data request now appears on my dashboard. If I click it, the panel will open, and I will find the request on the timeline on the right. In this case, I can fulfill the request by uploading an additional file to the medical documents form. Once finished, I can mark the request as complete. For this request I had the data ready at hand, and was able to upload it immediately, but if I didn't, I could have set the request to status pending, which is used when the request is awaiting more data to be provided, or an action to be taken, for example filling in a data form, or uploading an image. I could also put it on hold, which means the request is not yet to be processed, for reasons such as awaiting to invite the right expert to look at the request, or to assess the validity of the request itself. If all the data forms required are filled in, and if there are no additional requests for information, then the panel can move to the assessment stage. One of the features of CPMS that I will demonstrate now is the virtual meeting. It is worth mentioning that this is not just available in the assessment stage, but in all stages, from panel selection till the outcome stage. When setting up a meeting, you need to enter the title, as well as a description. You also need to select whether this is an individual meeting, or part of a series of recurrent meetings. The latter is something that can only be set up by users with the coordinator profile. Setting up the ERN meetings will be demonstrated at the very end of this video. You need to set the date, duration, and time of the meeting. The time zone is automatically set to that of the healthcare provider, where the patient is enrolled. In this case the healthcare provider is located in Prague, so the time zone is Europe/Prague, and this cannot be changed. Once the meeting is set, you will be able to invite participants. You can invite users who are already part of your panel, or you can use the search box to invite guests or other members of your ERN. You can also invite other users from your healthcare provider, regardless of which ERN they are working with. If you invite someone who is not a member of the panel, and not from your healthcare provider, they will be able to participate in the meeting, but they will not be able to see any of the clinical data uploaded to the panel. Any member of the panel can schedule a meeting. If the person who sets up the meeting is not the panel lead, the following rule applies. The creator of the meeting will become the host, and the panel lead will automatically be invited and set as the moderator. Both roles have the same rights, which we will see in a bit once the meeting starts. As soon as the meeting is created, each invited participant will receive a notification by email. It will also show up on the My Meeting widget on the ERN dashboard. The meeting itself will appear in the panel on the timeline. To enter, simply press the countdown. Once you are inside the meeting, you will see the video feed of other participants. In the example I'm showing here, there are only 2 participants. At the top, you have access to a small selection of tools. You can enlarge the meeting window to view all the video feeds in full screen, or you can completely minimize it, not to see any of them. You can also move the meeting window from the lower left to the upper right corner, in case you need to better view information on the consultation form. You also have a button for muting your microphone, and one for turning off your camera. The meeting component also has a screen sharing tool. This can be used by all participants in the meeting. It allows you to share your entire screen, or a specific application you have running. This can be useful for sharing information that has not been anonymized and therefore cannot be uploaded to the consultation form. The host and moderator can turn off and on other participants' cameras and microphone by clicking on the appropriate icons on the participant list. Similarly, they will also have the option to record the meeting. When the meeting is over, simply press on the red phone icon to end it. At this point, the host needs to mark it as finished and write a summary. It is also in this section that you will find the recording of the meeting, if recording was activated during the session. The summary and recording can be accessed at any time by all panel members via the timeline. In the assessment phase, every member of the panel is invited to write a contribution. The contribution is meant to be the panel member's assessment of the case, based on all data gathered throughout the process of the panel. Each panel member can see the contribution of every other member. You can attach a file to the contribution, and you can also specify how much time was spent writing the contribution. This is not mandatory and is only used as performance indicators. When all contributions have been made, the panel can move on to the outcome stage. The outcome stage is where the panel lead will write the panel outcome based on the contributions from assessment. At this stage, the outcome is only a draft, and not necessarily the final version.
Every panel member can view the draft outcome at this stage, so for instance, if I am not in agreement with what is written in the outcome, for example, if my contribution was misunderstood, I can comment on it in the timeline. In this case though, it's perfect.
Assuming that all panel members are in agreement with the draft outcome, the panel can then be moved to the sign-off stage. Here, the draft outcome can be finalized and signed off. Doing this means that it can no longer be edited. Signing off the outcome will generate an outcome letter, which contains the signed-off outcome, and is meant for the point-of-care specialist declared in the first stage of the panel. After the outcome has been signed off, the panel can be moved to closed. In order to transition to this stage, you have to specify how much time you as the lead spend on the panel. You also need to specify whether the panel was a success, and if so, what was the actual outcome: treatment, clinical trial, diagnosis, or other. Selecting any of them, except treatment, will prompt you to provide more details, similar to the question on how much time was spent on writing the contributions. This information is also used for the performance indicators that all users with the coordinator profile has access to. Once the panel is closed, it cannot be restarted. It can still be cloned if needed, which I will show in a bit. Lastly, if the patient gave consent to have their data transferred into the registries tool, a button will appear which allows you to transfer the data. The final thing to mention in the panel workflow is archiving. In the closed stage, a button will appear, allowing you to move the panel to archive. When you archive the panel, it is no longer visible within the ERN, it is only visible to the enrolling center, and the archive panel cannot be restarted. However, like closed panels, archive panels can be copied. This concludes the entire panel workflow. However, I do have a couple of additional things I would like to go over before we end. As mentioned earlier, you can copy and restart panels. In order to do this, you need to find the patient on your patient list, for which the panel you wish to copy or restart is opened. You select the panel and then you will have the option to copy. When you do, you will be able to choose which part of the panel you wish to copy to the new one. You cannot copy participants though. You can also restart panels. Doing this will move the panel workflow back to the open stage. You can also use this feature to completely abort a panel, if required. Unlike copying panels, when you restart a panel, those experts who were part of the panel before restarting are still part of it after, so you do not need to re-invite anyone. Users that have the researcher profile will have access to the ERNs database and registries tool, which can be accessed from the ERN dashboard. What this allows you to do is to generate reports based on the anonymized data transferred from panels within the ERN. The data is only transferred if the patient gave their consent to do so. The reports can be constructed using study templates, and within those, you have different tables that can be selected. Once the elements you want have been selected, you can generate your query. You can save it, and other researchers within your ERN will be able to view it. That was all from me. However, Dr. Harry has a final thing to share with you.
As a user with the coordinator profile, I have access to features normal users do not. On my ERN dashboard, I have 2 additional tabs. One of them is for key performance indicators. Here I can see reports on active users within my ERN, general activity, number of ongoing panels, and number of panels closed. I can also see the thematic groups of the ERN, together with which users are registered under each one. The other feature I have, which is only available to coordinators, is the ERN meetings. Here I can set up recurrent meetings. To set up one of these meetings, I have to enter the title and a start time. I do not need to enter an end time. Instead, I have to select how many slots are available within the meeting, and how long each of those slots are. I can also set whether the meeting repeats daily, weekly, monthly or yearly, and on which day of the week. Once it is created, it will appear on the list of recurrent meetings, and members of the ERN can book one of its slots when scheduling meetings within their panels.
I hope you have enjoyed this overview video of CPMS version 16.
For any questions or comments, please email our help desk. Goodbye.